Great. Welcome to another episode of Vital Doc Talk. And today we have Daniel Sugai with me. Daniel, welcome to the show.
Hey Vlad, thanks for having me. Appreciate it.
A pleasure. And we saw that you were starting a YouTube channel, which I love, which is kind of like in synergy with us.
Perfect.
So I love to talk about that and your plan there. But first, before we dive into, your marketing mind and how you're growing, why don't you give the audience a bit of a background of yourself?
Sure. Thank you. I'm Daniel Sugai, MD. I'm from Hawaii originally, and
Mm.
I from the island of Oahu, North Shore, from a small town and surfing town, Haleiwa,
Wow.
and did medical school. Did my undergraduate, then my medical school out there. Met my wife there, and we both matched into our residency. She's internal medicine, and I did dermatology. And we both went to Harvard Medical School for our residency. So after the 4 years there, we shipped out back to the West Coast, and we're now in Seattle for the last 4 years. So I'm in private practice in Bellevue and Renton,
Mhm.
and I do a mix of things. I see adults, I see pediatrics, I do medical, dermatology, cosmetics, surgical. So I do the whole full gamut. A really busy
Wow.
practice before this pandemic hit.
Oh wow, that's awesome. And you mentioned Harvard, very impressive, I might
Thank you.
add, as well. And we're also, for the audience that doesn't know, we're both located in the Seattle region. And it's funny you drop Hawaii in there because I actually, in last February, I was in Hawaii
Oh,
before
nice.
the craziness hit, and that it is
The
a gorgeous
timing.
place. Have you actually like seen any active volcano stuff at all? I was looking for that. I don't know if that's even.
No, not very common. You have to go to the outer islands to see some active volcanoes. Yeah.
Yeah. Okay,
Well,
no worries.
sounds like you
It's a
had a good
gorgeous
time.
place. Yeah, people
Yeah.
should definitely check it out. I recommend it. That's
Thank you.
great. And
Yeah.
so, Daniel, why don't we dive in a little bit into your practice, right?
Yeah.
And maybe how it's grown from when you first started. Why don't you tell us
Sure.
kind of the story there?
Okay. Yeah. Sure. Um, yeah, when I first arrived 4 years ago, I didn't know anybody. The primary care doctors didn't know anybody. I didn't have any referral base. So what I would do is just on my, my half days, I was only seeing just a few patients a day. I would go knocking on doors and bringing my business card, my bio, saying I did my residency in Harvard. I see adults and kids, and so I had to build that up. And after a couple of years, it's really my name started to get out there. I had a really good referral base from really great OBGYN, primary care, family practice physicians, and they would refer me patients. And now 4 years in, I'm just, before this pandemic, I was seeing, close to 40 patients a day, 4 days a week with a long wait list, and been really fortunate. I have great patient reviews, really good patients that I miss quite a bit right now. So yeah,
Uh,
that's my practice.
That's awesome. And I love that story because when we started out our first business, our third company, actually, for the audience doesn't know either,
Wow,
probably.
impressive.
But it is and it isn't, right? Like I had to struggle my way forward. Um, I graduated college 2 years earlier. Did not get into Harvard though, so that's very impressive. So did Harvard? So you gave one gold tip though. I think when you're first starting out, and just like me, you also had to go door to door, knock on cold doors, right? Do all the comfortable things that doctors don't like to do, and nobody likes to do these things, right?
Exactly. Yeah.
Did Harvard open up doors for you when you put that on your resume and you're like, hey, I'm from Harvard? Is that what people mentioned?
For sure, I'm pretty sure. Yeah, I definitely would put that as a selling point, just so that people just have that, initial, get their attention, grab their attention, and also just respect. They have no idea who I am. They've never heard of my name. They can't even pronounce my name. So, yeah. So it was a nice catching point when I put it on my bio with my headshot. Um, and it's also helped with other opportunities like on social media and speaking offers, speaking engagements. So
That's awesome. Have you done any speaking engagements as well? And has that helped grow in your business?
yeah, I've done some speaking. I've done grand rounds in Japan. I was able to go to two universities in Tokyo and Osaka, which is great. Japan being an awesome country, great food, great people. The hospitals were just so hospitable and allowing me to come and round with them and the inpatient team, to go to clinic with them, do some laser procedures, and then give a big talk, an hour talk at each place. So those types of things I really enjoy. I love being able to teach other residents, and I got to teach Harvard. I could say I taught Harvard medical students while I was a resident,
Wow.
and then yeah, right, with the brightest minds. And then now I'm able to teach family medicine residents in the area.
That
which is great. Yeah.
that is fantastic.
Yeah.
That is fantastic. And you got to teach Harvard medical students. That must be
Yeah.
crazy.
Yeah. It's
I
great.
imagine you probably got one of those like 1600 SAT scores or something. Perfect.
Nah, I did really well in medical school. Everything before that, I had to build up. So I guess it's just going into how we evolve, how we get better. Like my SATs, I didn't have the money or the resources to take a really good SAT prep course. MCAS, I
Mhm.
did do a prep course, but it wasn't, you know, stellar by any means. And then once I got to becoming a medical student, I was able to hone standardized testing by practice, repetition, and then I just killed it on
That
the
is
boards.
fantastic.
So yeah,
I love that. And for the people out there that probably, they're just because you went over your early years, right? So let's dive a little bit into there, right? You
sure.
have Harvard on your resume, which is amazing,
Thank
right?
you.
Props to you. But for the doctors that don't have Harvard, what do you think maybe they could do to position themselves better, right? If I'm a doctor, I'm coming in, is it maybe the region? I'm looking at, hey, I'm from, Seattle, you're from Seattle. What would you do, you think, if you didn't have Harvard, right? Maybe you went to a non-Ivy League school.
Yeah, I mean, I've always been about diversifying. But diversifying, but also finding a niche. So, for diversifying, in med school, I was, class president. I would do some research, but I would also do a lot of volunteer work and also, of course, student government. As a doctor, I'm saying the same, like diversify. I'm looking into investments. I'm looking at finance books. I'm doing real estate. I've started real estate investing 2 years ago. So
Wow.
not just having one income stream, doing some consulting, surveys. Um, we talked about speaking engagements. But yeah, I think diversifying, but also finding your niche and just being able to say, I am an expert in X, Y, and Z. And that will also get your name out there quite a bit, not just
100%.
the brand name. Yeah.
I think so too. I think, and that's why I actually have this podcast and the ebook and all that we talked
Right.
about. And so real estate, have you read The White Coat Investor? Have you read that book by
Yeah.
any
Right.
chance?
Uh-huh. Yeah.
Yeah,
Yeah. And
great.
their
That's
blogs.
awesome.
Yeah. Yeah. Hmm.
I
So
love it. I've read that too. So that's a tip for all the doctors listening out there. You should definitely check that book out.
yes.
And so let's say the doctor, a doctor listening to this, let's say they have a podcast or ebook or whatever, they have that initial source of contact to make them stick out. And then you get a meeting with another doctor in your early days. How did you have a format that you followed or a script you used, or how does that look like to get referrals from other doctors?
Oh, sorry. So Vlad, so say again. So if I'm meeting other
Sure.
doctors and
So let's say,
yeah,
so you've got the Harvard
yeah.
resume, right?
Okay.
On your sheet when you're passing it around, right?
Sure.
Let's
Yeah.
say another doctor out there, they find something to differentiate themselves and they're
Okay.
in their early years, they're knocking on those doors.
All right.
And then another doctor's like, yeah, Dr. Vlad, let's say I'm following your footsteps. So like, I'd love to talk to you. Let's talk about how we can do business together. What's that initial meeting look like? Like, what do you recommend they do? Is it just to get to know you? Is it a coffee? What would you recommend they do to build up referrals?
Yeah, definitely. I think just being able to put a face to the name is definitely huge. I think face-to-face contact is huge, not just email, texting. We're all about putting our heads down to our phone. So
Mhm.
exactly like you said, coffee, meeting face-to-face, just hearing about so when I interviewed for residency, I wouldn't talk about the nitty-gritty about, oh, I did research in psoriasis, lupus. I have this paper out there. I just want to talk about myself as a person, and will you be willing to work with me in clinic 5 days a week, or be in the hospital ward 7 days a week, 12-hour shifts? What do I trust my patients to go to you, and will you treat them well? So just being able to have that face to face and just talking about like non-medical things is great.
Really
Yeah.
interesting. So
Yeah.
just a social conversation, non-medical things, but then obviously you do want to show that, hey, you're capable of getting the job done, et
Exactly.
cetera.
Yeah. Right. 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 So one of the, yeah. So my interview strategy was really avoid talking about anything medical. It was like, let's talk about
Really?
leadership. Let's talk about student government. Let's talk about my volunteer work. Because you're talking to like the experts when you're interviewing. I had a whole panel of doctors in my Harvard interview. You go into this room with this big conference room, and they have all the names, the big names around, and they're asking you all these questions. If I talk about my research, I'm giving them an opportunity to, we call it pimping, to quiz you. and they will
Interesting.
tear it apart. And how are you going to defend yourself against these big names? So I talked about the other things, the things that make me a person, a human, more interested. I feel like they were more interested in that. They would lean in on those things. I also did art in college. I was an art minor, and so
Mm.
I brought my artwork into my interviews, and I would show them my artwork, instead of like my papers, like, oh, I was published in this journal, art, this journal, and this and this. I talked about my art. So
That's great. And you
yeah.
and you had, yeah, and that got you that credential. Did that same strategy of not focusing on kind of like the the doctor side, when you talk to your fellow doctors when you were just starting your practice and
Mm.
you were knocking on, other doors, did that same strategy that applied too over there?
Yeah, I think so. I definitely would have applied that. We didn't talk about the nitty gritty of things. I mean, I hope that they would trust that because I'm board certified. I went through the training. I'd say Harvard had one of the hardest inpatient training programs, and you rotate through the most hospitals for most dermatology programs, that they trust that I had the training behind it. I just wanted to make sure that they would trust me with their patients, because the primary care doctors, those patients have been with them for years. They have to make sure
Hmm.
they trust the other doctor to take care of them.
Hmm. That
Yeah,
makes sense. So
yeah,
certifications, right? Getting those definitely super important.
yeah,
And obviously you got to build those connections up.
for
So
sure.
did you build up your practice exclusively through just referrals mainly and building up your network, or did you ever do any other marketing type of
Yeah,
service?
no, that's a good question. We didn't spend any money on marketing really. So it
That's
was
awesome.
really through word of mouth, and just seeing some patients. If the family member was in the room, if they ended up liking how I did with their family member, they would make an appointment. And then from there, they would go and refer family, friends, and they would go back to their primary care doctor, give them feedback about their visit with me. And then we also had, our scheduling software, Cario, had a system where they would text the patient a survey, and they would fill it out and leave comments and reviews. And so we would have that up on our website.
Gold. So
Yeah.
shout out to, what's that company's name? Carryout?
Cario, Kareo.
Carrio. Shout out to
Yeah.
them. That's huge because I talk to doctors all the time, and some of them they have survey systems, some don't, and it's there's such a huge gap here. And I
Right.
personally, I don't know anything. I didn't go to Harvard. I'm not a doctor, but for all people trying to grow businesses out there, right? I
Hmm.
think having that survey is gold. I
Right.
know business owners with multi-million-dollar companies, and they live and die by these surveys. And I think that is the gold star because I was
Yeah.
like, wow, and you beat me to my next question, which is how, did you have a system or a strategy? It sounds like, correct me if I'm wrong, but the strategies you provide great service, you're
Right.
very personable, right, and professional, and
Right.
then you got a survey going out to see where
Right.
you can improve constantly.
That's exactly right. Yeah, it's always sticking with quality first, quality patient care. And that's why I didn't go into social media until 4 years in. It's just really focusing on my craft, coming up with a good um, style, really, because when you're in residency, I'm as a Massachusetts General Hospital, Brigham and Women's, Beth Israel, Boston Children's, you're going through dozens of different styles. You're working with different attending physicians. You have to just formulate and customize all those little pearls to your own practice. And that's what I was doing, is building that up, but being also a good person and a good, making good connections, meaningful connections with my patients during that time. And then it just blossomed from there. So yeah, you summed it up perfectly there, Vlad.
That's gold. And you did, and I was talking to Dr. Jessica in another podcast episode, and she came
Hmm.
to us and she was like, I think she was like her first year or something, and she's like, Vlad, I'm ready for SEO. And I was like, you're not to the size actually yet where you can actually do marketing, and I wouldn't recommend paying for it. So I
Mm.
did a couple hours of consulting with her, et cetera, and I taught her basically what you were talking about, where referrals, getting a good network in place, and just cultivating those referrals. And after a while,
Right.
she was just crushing it that same
Yeah.
way.
Oh, good.
And I think that next step for people maybe out there also is to have that referral system in there. And
Mm.
so that's great.
Right.
So
Right.
now, right, we fast forward to today's, you have a thriving practice just from referrals, which is
Yeah.
beautiful. Referrals, they're gold. You know it, right?
Yeah.
I know
Yeah.
it.
Right.
So COVID hits, and
Right.
how does that impact you? And how do you kind of, how are you recovering?
Yeah, no, I mean, for a lot of my fellow physicians out there, I mean, it's really like a bad dream, So my wife is a hospitalist. She's an inpatient doc. So she only sees inpatient, hospitalized, really sick, acutely ill patients.
Mhm.
in the local hospitals here. So it was a concern for her that she's going to be seeing patients with this new novel strain of coronavirus that's like SARS. We didn't know anything about it at the time. We knew that at the beginning of 2020 that it came, the cases emerged from China, and now the Seattle area became the epicenter of cases. In Everett, we had our first confirmed case. So there was a lot of uncertainty there, but also, what do I do with my practice? And what does it mean to be an outpatient physician, where my wife is inpatient, she's taking care of really sick patients? How do I limit exposure, and how serious is this? So every day or every week, the news around this changed dramatically, right? I mean, one week I was doing Botox fillers. I was demoing a micro needling device on my face, and my staff, we were just like having fun. And then right after that, we found out like, wow, this is a really serious virus. This is not
Yeah.
like the flu. This is not like the common cold. This is killing young and old. And so we had to really shut down and limit our practice. And it was just for the public health wise, for the greater good, we just had to call patients and reschedule. I had a lot of patients that, hey, I still want Botox and filler, because if I'm going to stay home, I don't care if I'm bruised up. I want this cosmetic procedure. And I was like, no, this is not urgent at all. So please reschedule. So we had to reschedule quite a bit of things. So, well, like I said, I was working, 4 days a week, seeing nearly 40 patients a day, very busy practice, down
Wow.
to just 1 to 2 half days a week, maybe seeing like 8 to 10 patients, just urgent. So my goal at that point was to become like a skin care, urgent care center, where we're trying to take off the burden of our emergency medicine, urgent care physicians, so that they can divert patients to us, so that we can help out with, like, I repaired some lacerations, really bad severe skin rashes, really bad blistering rashes that came up acutely. So I didn't want them to go to the emergency room, these patients, because I didn't want them to get exposed. I didn't want to overburden the emergency room. And then I was wearing protection for all of those things. I had my staff wearing PPE, masks as well. And then as more news came out, I ended up having to wear eye protection too, because we really found out that this was a highly contagious virus that questionable if it truly is airborne. There are reports that it can be airborne for 3 hours. And then it came out later on that it can live on surfaces between 3 to 5 days. And we had to really wipe down our countertops like crazy. And so it's really been interesting. And then the other thing I wanted to bring up is that we've really incorporated telemedicine into our practice, which is a brand new thing. I've always been interested in doing it. I've done it in residency, so I've had experience with it. But this is the first time as an attending physician I'm incorporating it. And it's been a change. It's been a change for my patients. Some of them were hesitant to do it, so I had to do some Facebook lives, Instagram lives, and just educating everyone that is a HIPAA compliant software we're using. It's very, I'm using protected secure Wi-Fi, and we're doing everything like a FaceTime Zoom meeting, really.
That's awesome.
Yeah.
And so when it comes to telehealth, what are your tips for doctors there, right? Because I'm imagining some of the audience members, they might have never done telehealth before, or obviously, as everybody is, they're trying to improve their current telehealth services.
Right. Yeah. So I would say that you can, there's telehealth where for a dermatologist, there's store and forward where they send you a high resolution picture, or do it live. Live has been really good for us. Not ideal though, because to see certain lesions, you need high resolution. You need a dermatoscopic zoom in on the lesion. So it's not ideal in that respect. But for things that you can just follow up on routinely, like I have a patient with on Accutane, a patient with acne and Accutane, I can just do a routine follow-up, and I can actually have them zoom in on their face and see how their acne is doing on their face. So those types of things it is appropriate. I'm only doing it for established patients, not new patients, because new patients have a lot more intake, a lot more
Mhm.
scanning of their information and their insurance cards. So it's just established patients only. And I really like it live because the other thing about it being live, you have to tell the patients that they have to have good Wi-Fi, because it can get really choppy at times. So that's another tip, is having your patients make sure that the Wi-Fi is good, and also making sure the lighting's fine in the room as well. You want the light coming up from the front. I'm also have a window behind me, so it's not ideal for if you're doing a derm visit. The window, the blinds are open and the light's coming through, so making sure the lighting's fine. And then also just reassure them that everything is, you're using a secured network. I mean, they like hearing those types of things. in the beginning, I actually had to call my patients because I found that when my staff would call them, they were saying, "Oh, I'm not comfortable," or "Let's just reschedule." So when I called them myself and told them the whole process, they really took to it and they were more comfortable about it. So sometimes you might have to call them from your side as the physician and not your receptionist to reassure the patient that things will be okay with this kind of virtual visit.
That's great. You know,
Mm.
and in a second, I'm going to ask you, you know, what do you think most doctors out there miss today, and what should they implement? But it sounds like all the tips, I mean, I've gotten a lot of value from you in terms of, you talked about how, you know, the referral system is very key.
Yeah,
You know, you gave us a lot of good telehealth tips. And I think a lot of doctors out there should know that, you know, for me personally, being a co-founder or an owner of a company, or if you're a doctor and you own the practice, if you're reaching out yourself, makes a huge difference
yeah,
versus an assistant or somebody that maybe hasn't met them or hasn't had as much contact.
that's
So
true.
that's very key as well.
That's
But
true.
yeah, to go back to that question, what do you think that you know, doctors out there miss today, and what do you think they should implement during this time?
Yeah, I think that we are, as physicians, we're just used to control. We miss control, I feel, just control over the situation, control over business, control over patient panel. We don't have that now. And there's so much we don't know about this virus that it gets scary. So for me, I would say that for me to gain control and to help cope with this, because it's really hard for everyone, right? This whole situation is that I've evolved, and we talked about, Vlad, a little bit how evolving with the times, like the fine dining restaurant Canlis, they
Yeah,
evolved with the times and they became a takeout restaurant, which is great. So I'd say to regain control, the thing we miss the most is that just doing things responsibly and safely. So donating, fundraising. I've done some campaigns where I've started donating moisturizers to healthcare workers at the hospitals locally, just saying thank you to our frontline workers. You're probably washing your hands like crazy, getting hand dermatitis, rashes on the back of your hands. So I've been donating moisturizers to them and making it like a social media campaign. So I've had other practices around the country thanking me, saying, "Dr. Daniel Sugai, thank you so much for um, inspiring us." So I've had other dermatologists around the country doing stuff like that, which has been making me feel really great, but also, making our healthcare workers feel appreciated as well. And then also I've done another campaign getting people to donate N95 masks and also masks with face shields. Because that was a huge concern when we didn't know when the curve was going to flatten. Thankfully, now it's flattening out. But at the
hmm,
time when it was really scary, they're talking about one day our healthcare workers are going to start wearing bandanas as masks. I was freaking out for my wife, so I was, making another social media campaign. So I got quite a bit of masks I collected and was able to give to our hospital. So like those kinds of things was nice in regaining control over the situation. And then lastly, I've really just taken advantage of this unpaid sabbatical. Really, this whole situation is just start marketing yourself, and just taking control of branding your name. And so I started Instagram in February, so just 2 months ago, and nearly 2,000 followers now. So I'm really proud of that. Just
nice.
organically grew without paying anybody or anything. So just getting your word out, getting that global reach. I've COVID-19 skin manifestations, but that started to come out. I've actually jumped on it because I've been seeing some urgent cases that have been relevant to that case. So I would make social media posts about it, and other doctors around the world reshared my posts in 3 different languages saying, "Read Dr.
Love it.
Sugai's post about COVID toes." So that's my way of educating the public at a global level. So that makes me feel great, makes me feel like I have control over things. And now, as you mentioned, I started a YouTube channel just because I'm not counseling my patients. I miss my patients. That's the thing I miss the most of my patients. I have great patients, great
Oh,
relationships with them, and now I'm able to just talk to the camera and counsel people as if the whole world's my patient. And then I've taken in the last 7 days I've released 4 videos on moisturizers, sunscreens, retinoids, and then lastly was serums. So this is a foundation of everyone's skincare, goals. Whatever skincare goals you have, that's your foundation. So I just started that up 1 week ago.
I love that. And
Yeah,
so I think that that's a huge takeaway for the audience, right? To basically, if you can get on social media and Instagram, for example, if you can actually address what's trending, and what's
Right.
popular right now and what everybody's concerned about, which is obviously coronavirus is a big thing there,
Yeah.
and
Yeah.
how it pertains to your industry. Go do that and make it taking advantage of the sabbatical to grow your online presence. So
Exactly.
that's great. I love
Yeah.
that, Dr. Daniel. Thank you so much for being on the show. Where can
Yeah.
people find you if they wanted to reach out?
Sure. Yeah. So you can find me on LinkedIn. I'm on Facebook, and then Instagram. I'm at Daniel Sugai MD. And then my YouTube channel is Dr. Daniel Sugai, where I'm going to be putting up skincare tips. I'm collecting quite a bit of suggestions from the world, asking for things on acne or moles and such. So I'll be doing videos on that. So stay tuned and please subscribe to my channel. Please like my videos, and also, yeah, Instagram, starting that up, and I'm having a good time with that. So.
Awesome. Well, this is
Yeah.
Vlad with another episode of Vital Doc Talk, and thank you guys so much. Have a great day.
Thanks, Vlad. Appreciate it.
Thank you.